Type K is a study to investigate the role of potassium supplementation in the prevention of atrial fibrillation after cardiac surgery, and in our case in particular CABG surgery, coronary artery bypass grafting. AF after cardiac surgery, AFAX, is the most common adverse event after cardiac surgery, affecting about 1 in 3 patients after CABG surgery, and it's associated with morbidity, mortality, length of stay, cost of care. And that has led to many interventions that caregivers have come up with trying to prevent AFAX. However, there's large variability in that practice and very little evidence base for most of the interventions. And one such example is potassium supplementation. So many of us were brought up during our training to keep a very close eye on maintaining serum potassium at the higher end of normal, so above 4.5 millicurie per liter. But when I looked into this, there's actually no evidence base why that should be effective in preventing AFAX. So Type K is a randomized controlled trial with a non-inferiority design, and between October 2020 and November 2023, we randomized 1,690 patients at 23 cardiac surgical units in the UK and Germany. And we randomized them to 2 arms. One arm is what we would consider current standard practice in the UK, and that is to give potassium proactively, aggressively, aiming for a serum potassium level above 4.5. And the relaxed arm, the other arm, we would only give potassium if the serum level actually dropped below the normal, i.e. if patients became hypokalemic. So there are 4 main findings. The first finding is observational but interesting. So the trial treatment works, and if you look at the tight arm, the median number of potassium administrations, doses of potassium, was 7, with some patients receiving in excess of 40 doses of potassium. In the relaxed arm, the vast majority of patients didn't need any potassium at all. Now, that did have an effect on the average serum potassium levels that were moderately higher in the tight arm, but also homeostasis seems to work. So there was no significant hypokalemia in the relaxed arm, and equally the elevation of serum potassium levels in the tight arm was only moderate at best, despite the big difference in effort. The first key finding is the primary endpoint, and that is to say there was no difference in AFAX rates, AF after cardiac surgery rates, between the 2 arms. And when you look at AFAX detected by any means, so patients actually wore an ambulatory heart rhythm monitor in addition to routine monitoring to pick up maybe AF that wasn't noticed clinically. The overall AFAX rates were 33.1% in the relaxed arm and 33.0% in the tight arm. The next and very important finding is that there was no difference in safety, so particularly dysrhythmias other than AF. And here, of course, we particularly focused on VT and VF, no difference between arms. There was, however, a significant finding, and that was a big difference in cost. So potassium, despite being cheap as chips, is actually one of the highest spent drugs in our pharmacy budgets. And that is because we use so much of it, trying to keep the potassium levels high. And there was a 4-fold difference in mean cost per patient between the relaxed and the tight arm.